Jim Joyce,
Here we
welcome
are.
to Wednesday, mi amigo. I
Welcome.
too bad. I know you texted me that you're coming to good old BCN next week, but we're not here. We're in Emmy's home country next week. So
Yeah, no, I was crushed. I was crushed because hopefully I'll get back to Barcelona soon. But keep the
ne
weather good.
next time.
Yeah, yeah,
Um, it's actually I don't open Facebook much. I just happened to open it today.
yeah.
Almost never on it, and it popped up a memory. We had Leonora on exactly 4 years ago, which
Ah,
is crazy because I'm like, okay, when did we actually start this? And it was
right.
April 16th, right in the midst of the pandemic. So, dude, next year, April 16th is going to be our half a decade anniversary of this crazy ass show.
You and I talking to each other. The
Yeah, and wonderful guests that bear with us. But
yeah, exactly,
yeah,
exactly. And then obviously today is September 11th, right? So
yeah,
today's
yeah.
so thoughts and prayers to people
Thoughts and
out there. I'm
prayers.
sure.
Yeah,
I know you
yeah.
are a New Yorker, and I was in University of New York, so we lost some good people. So thoughts to them.
Yeah, we I mean still remember actually Marina and we both actually got laid off at that time from our jobs. We were in New York and
Yeah.
we were actually in Italy because we said, "Oh, when is the next time we're going to be able to go to Europe for 3 weeks?" Well, here we are 13 years later back in Europe, right?
Yeah.
So
Yeah.
and our guest just exited, so hold on a second from our waiting room.
Okay.
Um
She got fed up.
unless Zoom, does Zoom kick out after a while?
I don't think so. I don't think so.
Hmm.
Yeah. But let's get her back in anyway. I think it would be more
Yeah,
inspiring.
as she's just texted her to jump back in, but yeah. So I mean, I still actually remember we just pulled up to our hotel in Milan, right? So we're kind of clueless, right? We're just driving from one place to another. We had no idea, and then people are like looking at us as Americans, and they're like, so sorry, like it
Yeah, what
was,
happened? Yeah, yeah,
yeah, what
yeah,
happened? We had no idea. So, and multiple
yeah,
messages from my dad, but yeah.
yeah. Emmy
Crazy
was there.
world.
Emmy was
Oh,
Emmy was
really?
heading into Goldman Sachs. Yeah, she was with Giampaolo, my
Oh,
now
wow.
23-year-old, 8 months pregnant, heading right in. So it was kind of
Yeah, but
probably a lot of good reason we ended up in Europe.
appreciate you bringing this. Thank you. I honestly didn't even kind of hit me
Yeah,
until you said it, but just been envelope. But on a very different note, switching
right.
back to I guess positive energy.
Awesome.
I'm gonna let Dorsa in, and
I've I've heard
it's
I've heard a lot about this energy.
yeah, you've been she's jumping in. So the a little bit of the background and all of this.
Hi,
We
I'm so
had
sorry.
That's okay, no worries. Hi Dorsa. Welcome, welcome. I was just we can see you, we can hear you. Wait, are you actually doing this from
I'm at the hospital. Here's my son.
I hope he's recovering well.
Oh my gosh.
That's 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 dedication to the shot. I last minute invited Dorsa. And she's like, well, my son is in the hospital, but I don't know if I'm like, please, we're
I'm not
meticulously
doing
on
anything.
now you are. How is he
Yeah,
recovering?
he's fine. Yeah. I mean, he's 8, so they've recovered like this. So,
Yeah.
oh, we did internet. But
Oh,
yeah, he broke his femur.
you're on
Jim,
mute,
you're on
Jim
mute.
Joyce.
I said there's a lot to unpack here. There's a lot to unpack.
Be,
Nice to meet
before
you.
before before we unpack all of that, so just what we usually kind of give a little bit of the background, and we actually usually don't do this. It's so Dorsa and I got introduced by our mutual friend Bryan Sivak, who was on the shot probably just a few weeks ago, and I remember Dorsa, we just had a call, and I just like felt your energy coming through the screen. And I thought, we are meticulously and produced. We do everything last minute. And I'm like, who can give us a boost of energy? And our listeners.
Expertise.
And so with that, we can unpack now, but would love to just take us through your journey, both professional, personal, however you want to take it. And then Jim and I, as usual, we rudely
So
interrupt.
energy level right now is at 50% because I haven't slept for like 48 hours. So just excuse me if I'm not as fun as you expected.
Zero expectations, Dorsa.
And you have my son, you can see him. I'm sorry, I can block him. But yeah, so professional level, personal, I guess it's all mixed because we work most of our lives. So most of our adult lives are at work. I started in healthcare right out of college. I was doing care coordination for like public health, so STD work, and it was actually really fun. Actually, I was still in college when I started doing it, and it made me really like nursing, just because I like the interaction with patients. And the nurses usually use me to call young patients to tell them they had STDs. Because back in the days, we used to make phone calls to tell them that like, hey, like you have to come in to take your antibiotics because you have gonorrhea, right? And they would make me do it because there were no cell phones, right? Like this is like 15 years ago, kids didn't have cell phones. 20 years ago, actually, sorry. So I used to call their homes and their parents would like pick up and be like, hi, is Claire there? Be like, hey Claire, you have chlamydia. Like,
and the parent is on the other line, still didn't hang up.
Yeah,
right?
exactly. Like, can you come in? So that was like my first healthcare experience.
In what country?
In the US.
In the US, okay.
I went to UC Santa Cruz.
Okay,
So,
got it.
yeah, so it was in Santa Cruz Public Health Department, and it was weird because I would like know everything about everybody because I worked for the public health department. So like, oh,
right.
I know this guy has STD,
That's
weird.
That's a wild way to start.
They were automatically entered to your
college.
do not call list, do not post.
Yeah, exactly.
List.
It's like, or like tell my girlfriends like, I wouldn't go out with him.
Just kind of, he's not the right type.
Hunch. So I really like nursing. So after I graduated, I worked for a while and then I went back to school and got some extra credits and went to nursing school. And because I had studied already like biology and health sciences, I only did like a year of nursing school. And then I got my master's in case management. That was another thing I really started liking. I liked going just investigative work, all of that. And then I had a stint at Kaiser for just a little bit. And then I realized I hate inpatient case management because it's basically just kicking patients out of the hospital. So I ended up working at Haight-Ashbury Clinic in San Francisco and do HIV case management for homeless people.
Wow.
That was fun.
Wow.
Yeah, like to a point, like I would have to go to the park and find my clients to bring them in to give them their medications. So a lot of the homeless people in that area knew me really well. It was pretty funny. Like I would go on dates with my now husband and they're like, hi, Dorsa. And they're like, who's that? I'm like,
how do you know these people? Yeah.
like, why do you know these homeless people? So
wow.
that was really fun. And I would have probably done it forever, to be honest with you, but I was in a lot of debt from school and it just didn't pay well. And
what did you, I'm curious to double click on that actually. What did you, I'll say, enjoy most? Because you comment like, I would have done it, for a long time. What was
it was exciting. You just didn't know what you got. And it was, it was helping people. You felt good about what you did. It made people's lives better. But mostly it was really exciting because you just like, it was unpredictable, right? Like
right.
you never knew who was going to come through the door or who was going to come through the door.
Right.
So that was exciting piece of it. But
so after the buyers club, where'd you go from there?
After that, I got a job with Meritage, which was my company that I just basically ended my relationship with recently, about 6 months ago or 7 months ago. I started as a case manager and it was weird because I it's one of those things, like I started doing it. It was for ACO, Accountable Care Organization, that I just started the Medicare Accountable Care Organization. I did outpatient case management for chronically ill patients. I loved it, just going to people's homes and med recs and all of that. And then I had a child, and it was really difficult to commute because I was living in Oakland, and that one, exactly
That guy,
one.
that guy
That
over
one.
there.
9 years ago. And I asked if I decided to work closer to home, but they didn't really want to lose me. So they asked me, like, what do you want to do? I said, I want to do something where I could work remotely a little bit, at least a couple of days a week, because I was still breastfeeding and like I needed to be home. And so they're like, do you know anything about risk adjustment? Not really. So they're like, we don't know either. And we just signed the MA contract. And apparently we need to do really well in this thing. Can you like figure it out? Okay.
Oh, so it's not just startup, fake it till you make it, huh?
No. No. This is like a big IPA. Yeah.
Yeah.
And they're like, oh, we like met with some like consultants and stuff, but we just don't know like how to operate it, right? And I'm pretty good at like I don't know, I think my mind, that's one of the reasons I liked case management. I'm really good at like operationalizing things. Like I'm not just like, it's a good idea. It's like, how do we get this to work? And I'm also very like, get it done. Like we got to get it and we got to get it done. It's probably come from like being an immigrant child, like first generation, where like you just had to figure shit out. You know,
And
like your parents had like
where'd your
50
parents
jobs.
where were your parents
From
born?
Iran. We moved to the US when I was 12.
Okay.
So my parents had multiple jobs and we just figured things out. Like I figured out my homework and I figured things out. I figured out how to speak English. Like,
Right.
Just
so.
quick side note, Persian food is one of our favorite foods. There's like multitude, Marina loves reading cookbooks, and like I'd say easily once a week she cooks something Persian. Like it's amazing.
I know. I love it too. Whenever I go back home, I gain like 5 kilos. So
Back to Iran.
yeah.
Okay.
So I don't know, I just studied case risk adjustment. I met up with a bunch of coders and learned about it, and then learned how to like implement it into already existing programs of case management. So like I had the nurses and coders kind of work together with patients because it all relates, right? Like if somebody with diabetes, they have higher codes. So like, let's capture those. And then I realized quality kind of comes into that too. So I just built these programs and it worked. I helped get the score, the risk adjustment score up from 0.6 to 0.9 within 2 years, which doesn't seem a lot, but it's a lot.
Right.
Oh,
So maybe
almost double.
For some of the people
I'm
that don't
a-
understand risk adjustment, what does that mean exactly? So
So
what were
risk
they doing?
adjustment, basically what Medicare does is they assign, so each ICD-10 code for like a chronic condition, they have a score attached to it, and that's like the risk score. It's based on like the risk of the patient, and like diabetes, for example, the chronic conditions have really higher risk, or like somebody on dialysis has higher risk. So they combine those scores and they pay you based on like what's been captured for the patient the previous year, right? So they say like,
Okay.
this is how sick your patient is, so this is how much we're going to reimburse for the patient, PMPM or per month or like per year, right?
Or capitated rates.
Yes, and it's really important to capture these conditions every year, because in Medicare world, like you have an amputated leg last year, but your doctor didn't put it in your note this year, the leg grew back. So your cost more, like your cost less now because you have a leg now, right? Which is,
So
it's
your risk of score went up.
exactly. So it has to be captured. It's crazy. It has, but it's Medicare, so it's
Right.
okay.
Yeah.
It has to be captured every year. So, so that's like the biggest thing, that like making sure that the patient is seen every year and then the physician captures it. And then another more important thing is the more like specific you capture a code, the higher reimbursement you get. So like if you you say like the patient has diabetes and you just put diabetes ICD-10 code, like diabetes without chronic conditions, but then you put retinopathy differently, the two codes weigh less than if you say retinopathy due to diabetes.
Okay,
right?
interesting.
So like the reimbursements are higher if you're more specific. So you just have to learn the different specificity and like what applies to the patient to building these programs and have the doctors actually capture the codes.
What's more complex, Medicare or general commercial health plans? Or both equally complex, or?
Definitely Medicare, I would say, is a lot more complex just because commercial as a managed care organization, you have more
Flexibility.
ways of changing things and making it your own, whereas Medicare is very like gray, like black and white. There's no gray area, right? Like you have to follow the Medicare requirements, you have to follow the rules. Obviously, people always find like little ways because the language is so vague, so you could kind of interpret it the way you want to, but like you do not want to get audited by Medicare. So you usually like follow the rules pretty strictly.
You mentioned you work with techies and clinical, right? What about you? I mean, there's policy, there's legal aspects. So where does that come in that operationalization process, right?
Yeah, so that's like compliance, right? So like
Yeah.
we have a compliance officer, so you have to make sure that like I never read it. Like they would just read it and summarize, like these are all the Medicare rules that you have to follow. And you're like, oh, okay. I've started to learn more and understand like what to read, I guess, because there's millions of pages on Medicare and it's really complex. So you just have to learn like what to look for and like what's really important, right? But yeah, it's compliance usually, and like
I'd be curious who is doing that with AI now, what companies, right? Because I feel like that's a perfect use case to summarize the millions of pages. I'm sure people are just using it, but I'm wondering if there's any companies that are actually focusing on this.
Yeah, I mean, I'm not gonna lie, recently I had to look through some compliance stuff for utilization management because the Medicare rules have changed. And I was like, this is crazy. Like, if we're gonna do these rules, there's no point to have a managed care company when you have to follow all these rules. Like, we're gonna get killed, right? Because they're like, oh, like just an example of utilization management. Like, if a patient needs to go to a skilled nursing facility, they need to meet X, Y, and Z, or they don't go. Like why have managed care if you have all these rules? It doesn't make sense, right? Like the managed care company would not want to do these contracts. They're gonna lose out big time. So I did put it all through ChatGPT and I was like, summarize. Like, I'm not reading all this, you know, and it helped, you know, it was like summarize, like, so it was like kind of, I mean, obviously it didn't tell me what to do, but it just summarized at least like the hundreds of pages that I had to go through. And I asked specific questions like, can you find specifically to this rule and tell me like, and source it for me. So then at least I knew where to go to look at it, right? So that helped. So that was just using AI, just ChatGPT. So it wasn't even something complex.
Fascinating.
Right. And when you impacted the score, you know, what were you like? So I can imagine that it's a question of like, so practically it's like, you know, you improved my condition, so I got a better rating after so you evaluated me on this year, and then the next year you evaluated me and a condition improved or my BMI improved. Like how does that work?
So no, risk is mostly money for the company. So I mean, we like to say that yes, it does impact patients because if you are capturing their whole conditions and you're capturing all of their chronic conditions, obviously you can give better care to the patient. That is a fact. But at the end of the day, risk adjustment, it's about getting the highest reimbursements you can get.
Got it.
Like every 0.1 is about $2 million.
Oh, wow. Okay. So you missed out the fact that I you know, hadn't grown back the leg and now you put it
Exactly.
in.
So now
So
you get
now,
the highest reimbursement, because if you think about it, like a managed care company is kind of in the middle of health plans and the patient and Medicare, right? So like
yeah,
Medicare gives you a certain amount of money to say, take care of these patients, right? So how do you make money is for these patients to use the system the least amount of times, and you get the highest reimbursements. So what you try to do is like get the highest reimbursements, and then you create all these case management programs, or you change your utilization management rules so the patients are utilizing less services. And this is why during COVID, everybody was making money, because yes, you
Yep.
had the outliers of like the COVID patients that were in the hospital for days, but like somewhere like in California, a lot of companies made a lot of money because they had the shutdown. So people, but then what happened? They didn't plan for it. Is now everyone's getting killed because the last 3 years after COVID, utilization has shot up like more than any
Yeah.
year in the last like
Delayed
15.
procedures, undiagnosed
And
stuff,
not, yeah,
right?
exactly.
right.
And not only that, the people who had diagnosis are worse off now because they didn't get the care they needed to for 2 years. So now they're more expensive because we have people on dialysis, more people on dialysis now because they didn't get cares for the diabetes, or their congestive heart failure is worse. So they have to get more stenting and more. So just like it blew up. And that's why a lot of healthcare companies right now are struggling because in the US because of that. And I mean, I guess all over the world, like in Italy right now too, I'm in Milan now, they're struggling because they don't have enough doctors because so many people died. Like so many doctors died and they haven't been able to replace that workforce.
Okay.
So it's, yeah, it's like this weird jump that happened after COVID.
Right.
So
Right.
I'm sure we'll come back to it, but the Meritage, I'm pronouncing correctly?
Meritage.
Okay, Meritage, sorry. Got acquired by Babylon,
Mm-hmm.
post Babylon going public. And Babylon, at least to my knowledge, I mean, had some care management, but pure tech initially, diagnostic, AI, and you guys were a network, right? You were operating clinical
Yeah.
services. Yeah, tech was sure, EMR, EHR. Kind of maybe walk us through a little bit of that experience on, I'll say, the upside during the acquisition, and then obviously, what
Yeah,
what
we all
you
know
guys
what
have gone
happened.
through. Yeah. And we
Yeah,
don't need
so
to get into all of it, but
yeah, of course. Yeah, so when Babylon actually Meritage, I wasn't part of senior management yet when Babylon acquired Meritage, so I wasn't in those conversations. I was on director level. But I remember that our CEO came and said that we found this amazing company because we were always like talking about getting into technology and getting more tech into our services for cost savings and all of that. They said we are gonna partner with this company that's super tech driven, like they're very successful in the UK, and whatever. We're gonna
yeah.
Yep.
merge. Great. And I ended up being like the middle person between like my company and Babylon because they lacked the operations piece of like what you do on the grounds. And also they didn't understand US healthcare. So I was kind of
Right.
like the translator for them, like how would this apply in the US? Because great, that works in UK. That's not going to work here. Like all the
Right.
compliance stuff. Like I'm like, do you know about these Medicare rules? Because we can't do that here,
Right.
or like the rules, you can't do that. So, which was great because I felt like I learned a lot on the technology side, right? Like I learned like how the word AI gets thrown out, but like how AI
Yeah.
works. Like AI works in everything, everyday life, like when it comes to technology. But like I was so removed from that because we were so traditional, like, like yes, we use EMRs, yes, but that was like enough technology that we did. Like healthcare is like archaic still, like people still fax in healthcare, like that's where we are in the US healthcare.
Right.
So it was kind of eye-opening and like working with
Sorry,
like
I just saw Jay Parkinson, who we need to get him on actually. Only in healthcare we can say, well, I'm going to use AI to auto summarize all my notes and then to fax it somewhere else to a
yeah,
PCP, right?
exactly. Yeah, it's crazy. Yeah, it's insane. So it was really eye-opening, and it was like working with super smart people because Babylon hired like the top people. So it was like a little intimidating, but also it felt good to just learn from these people, right? Like they had knowledge base that we never did. So it was great both ways, but it just they moved too fast and they shouldn't have gone public. I think if they didn't go public, it probably would have been successful, honestly, because they just didn't have the tech that they were saying that they did. And if they didn't go public, nobody would have looked into it to know that they don't have it. So,
Okay.
and they would have built it eventually because they had the
Right.
people to do it. It just, they weren't there, right? So, I don't know
They're
if
still in the
I
hopes.
was telling this, Eugene, but I like at some point, when we were working on something, I was like, this feels like Theranos. Like, I don't like this because you're saying you're doing something, but like, we're not. We're like doing Google Sheets. So this is not good. And that was, I think that's the biggest
Fake it till you
biggest
make
thing.
it.
Yeah, exactly. And that's the biggest thing I've seen, which again, I think it was very eye-opening for me because I always thought of like tech companies. It's like, oh my God, like, you know, they know everything. They have everything set up, all these amazing things that like you see, you know, like, and just seeing that like how removed the engineers are from the actual operations piece and not understanding like what actually needs to happen for it to be implemented. It was very eye-opening. And I would try to like kind of be like bring them down from heaven to earth, like, hey guys, like you're
Right.
working on like this AI technology that like the doctor, exactly what the sentence you just said, the doctor can use it to talk to it, and it can just, they would save like hundreds of hours of patient care just to tell this like AI to do all their work for them. They don't even have to chart like all this stuff. I was like, you're talking about this, but like we can't even get the appointment system to work and we're using Google Sheets. Like, let's try
Right.
to fix that first before we go here.
Right.
You know?
Crawl,
Like,
Right,
you're
crawl,
working on the
crawl before
wrong
you walk.
thing. Yeah,
Yeah.
exactly. I'm like, you're like working on this thing over here, and this thing, like the main thing that you're selling isn't even working. So that was a very good learning objective
experience.
for me, I guess, and
Yeah.
experience, because I was like, okay. And then also it made me think like, oh, maybe I have something that I could offer in this tech world, right? Because I understand traditional medicine. I understand operations. I've literally been through all of it, like from like a tiny clinic, you know, uh in San Francisco to like a public health clinic, and just seeing how things work, you know, or doctor's offices, specialist offices. So like, how could the tech actually work in these clinics? It's not just the idea of like selling the tech, it's like, how is it operational in these clinics?
But
So
Dorsa, it also seems like you just like picking those like very prickly problems to solve. Is that even a word? Like just more
yeah,
like, okay,
maybe.
this is something new, something to discover, something to learn, something to just put my hands around and my brain, right? Just
I like to learn. I get bored easily, so I like to I like to learn new things. So if it's something challenging, I'm not just like, oh, well, I can't do it. It's like, oh, let me see. Like,
Yeah,
how
you
can we
seem
learn
like
this? You know?
you might be an excitement junkie.
Yeah, a little bit. And also, I think one thing that I always told my staff, like, don't be afraid to sound stupid, you know, like just ask. Like if you don't know something, and I do, you know, like if I don't know something, I'll go to somebody and be like, hey, I don't know this. Can you just explain it to me in like dumb language because I don't know it, you know? And it's like I don't know it. Why should I lie and say I know it? Yeah, fake it to make it to an extent, but like at the end of the day, no, I don't know it. I want to learn
right.
it. You're an
And
expert. Teach me.
and a
Right.
9-year-old behind you needs to understand it, right?
Yeah.
Yeah, exactly. Exactly. So I think that's something that I've never been afraid of doing. But I think this whole experience, this whole Babylon experience, and then kind of gave me more of like, okay, like maybe I know more than I think I know. Because again, it kind of goes back to the immigrant mindset, because you are raised to just make it, right? Like make it,
Survive.
make your
You gotta
parents proud
survive.
of
Right.
you,
Just
you
survive.
know, just survive, but like make your parents proud of you because they've worked really hard to bring you to the US and make you
Right.
like, you know, take you away from the crap from your country. And like, so like, just be independent. Like, you're a woman, be independent, make your money. So like, I'm good, right? Like, you always like, you had that. So we don't take risks, right? We're just like, all right, I got it, I'm good, let's stay. But like, that kind of like made me think that I have more to offer. And then when my husband 2 years ago said, hey, like, I got this offer in Italy and I would really like to move. The kids are smaller. We talked about maybe moving to Europe when the kids are smaller, to experience like Europe when they're smaller, and then we come back to the US. So do you want to go for 2 years? I was like, well,
and your husband is Italian, right?
Yeah, he's Italian,
Okay.
and he's a neuroradiologist. So he's a doctor. But he never took his board in the US, so he was working research at UCSF.
Okay.
We met at a bar. We didn't meet in healthcare.
Even more amazing.
Yeah, it's like before apps, right? Like, people talk about bars.
Yeah, exactly.
But yeah, so and it was horrifying for my family. Of course, they're like, what do you mean? Your career, you just made it. You're a VP, like, you're not even 30, like, you're not even 40, like, you know, you like, how can you give this all up? Like, all this stuff. I'm like, well, like, maybe I don't have to give it up. Like, let me go talk to my boss. And actually, I didn't. Like, my boss was like, yeah, you can do it from there. Let's see how it goes. We need you to like get us through this whole Babylon crap that happened. And so let's see if you can stay and do it remotely. So
Amazing.
I moved.
So
to where in Italy?
First of all,
Milan.
To Milan.
Yeah.
Okay. Did you
first
like
of all, you two should start have an Italian spouse club and share stories.
Yeah.
Maybe that's another spin-off.
Yeah, we both have Italian spouses. We both have Italian. Yeah.
Nice. They're very I always say, like, my poor son, my kids are like screwed because they have an Italian dad, Persian mom. They're very emotional. There's a lot of dramatic, like, they're very dramatic.
Yeah.
I don't know. I mean, I can't really fully see him, but he seems very chill back there.
He's on drugs.
Oh, okay,
like,
fair enough.
Like, totally high.
And so sorry, you're in Milan right now, right?
Yeah.
Okay. So, and they're putting your son's leg back there.
Yeah, so no, this is a second surgery. They're taking the metals out of his leg. He broke it in skiing in February. So he had the major surgery in February, and then they put metals in his legs. But because kids grow in like 10 months, 11 months, so they had to remove it. But he's completely, like, they showed me the X-rays. It's incredible how kids like just like.
So this is a celebration of him getting.
Yes,
better.
This is the finale. It's like, I'm done with this shit. We're done. Let's go. I'm not sure if you're going to ski again, but I would like you to, because I don't want you to like be afraid of skiing.
Finalmente.
Yeah.
Before we move to Jim's kind of famous last question, I'm actually curious. So how long you been now in Italy?
I've been there for 2 years. I'm sorry. Hold on. I just have to.
No worries. Yeah, you warned me, and we said we meticulously unproduced. It's all good.
Do you understand him, Jim?
I couldn't hear him that well.
You just said my mom in Italian. Mia mamma sta lavorando zitto. Yeah. My mom's working. Please be quiet. That's what he just said.
So I was saying, before we go to the final question, I'm curious, and hopefully you didn't get much experience with the Italian healthcare system, but maybe just observationally contrast.
Yeah, so 2 things. I actually did get a job here at a startup for like a hot second. They wanted to do telemedicine, but like not for like, it was most for like healthy living kind of thing. And they hired me, and it was through like one of his friends. Like, oh, I know this startup, they're looking for somebody like you. And they hired me to like kind of tell them what not to do or what to do, and what everybody here wants to be like the American systems. Like, we want to make money, right? Like, okay, but you have a different system, so it's kind of different. But so I helped them out with it, and it didn't go so hot because, first of all, I think I was too intense. He didn't like me. They were like, you're too American. I'm like, well, you asked me to, so I am being it. But like, you literally asked me to tell you what doesn't work, and I'm telling you what doesn't work. They're like, well, you're
Yeah.
wrong.
Oh,
Okay. Like, and
both
then it was
rollful.
like super inefficient. Like, they still literally haven't gone live, and this was like 2 years ago, and they were supposed to go live in 6 months. So
Yeah.
it was, and at some point, I think I was just too annoying for them. And they like literally, I know, it's so sad. And it's the first time in my life I got ghosted, like ever. Like I've never even been
Professionally
ghosted by
ghosted.
a man. Like I got ghosted by a company.
I love those. Like I've been in Ireland for 20 years, and I'm still after 20 years, I'm still the resident Yank. You know, so
Yeah.
the Irish, you know, like, oh, there's the American in the corner. So if they need some, but I could be a little bit too intense for them as well.
Yeah. So I have their laptop. They just stopped contacting me. I'm like, okay. So that was
Awesome.
my Italian work experience. But healthcare here, like just going through his experience, I mean, obviously I was shocked because we took a helicopter out of the mountain, ambulances, ER, urgent care, like 8 days of hospitalization, surgery, and we paid nothing.
Right.
Like what? like,
Right.
like my copay would have been like
Right.
$100,000 in the
Right.
US, you know?
Yeah, just
So
the
Yep.
bandages would have been 10 grand.
yeah, exactly.
Listen,
So that was incredible.
that's why many people marry Americans that I know are getting their European citizenships wherever they can, however they
Yeah,
can, through,
Mm,
great grandparents, through whatever, right? So many
yeah,
people.
for
yeah.
sure. But it's definitely different. Like there's no bedside manner here. Oh gosh. Like it was crazy because I worked in pediatrics for a little bit, like during my residency with my RN residency. And like they always get told us like when you walk into a patient's room, a child's room, the first thing you do is talk to the parent. Like look at
Yeah.
the parent. Like the parent is your patient, right? Like
Hmm.
here, like they literally walk in like I don't exist. Like they walk
Right.
in and they start just talking to him and they start like putting stuff on him. And I'm like, wait, what? Like, what is that? Like, and they look at me like, how dare you ask us what we put into your son's body? Like we know
Right.
better than you. I'm like, yeah, I know, but like I would like to know. like, like,
You
what is
deserve to know.
it? Like, can you just tell me what you're doing? Or the surgeon came with like 6 other people and they just talking to him. The surgeon wouldn't even talk to me. And I was
That's
like, what? Like, I'm sorry, like I need to understand what's happening.
sure that's
How
not a
how is
Milan
your
thing.
Italian?
Good. I mean, I understand things and I can like respond appropriately. I mean, obviously, like I have an accent and they
Yeah.
know I'm not Italian, and I say some words incorrectly, but
Mm,
like I know enough for them
Get
to like
around.
acknowledge me.
Yeah.
Like
right.
um
Right.
so that was hard. So the first time, this time I've gotten used to it. So I'm like let them and I just check things later or like I ask them
Got
stuff.
it.
But like the
Yeah.
first time it was definitely like I was like, what is happening? And I was definitely the crazy American mom.
Right.
They thought I was
The,
insane. I don't care.
the helicopter parent.
Yeah,
Yeah.
totally. I
Literally the
mean,
helicopter
yeah,
parent.
Literally, yeah, literally a helicopter
yeah,
parent. Yeah.
literally. And I was like, I don't care. It's my kid. Like, I want to know what happens. It's just like, I don't care. You can think I'm totally insane. And also, like here, the difference is like, there in America, you go in the hospital, they have to get you out immediately, right? Here, like they're like, oh, the physical therapist came and they're like, okay, buddy, like get up. And he goes, no, I don't want to get up. And they're like, okay, we'll come back. And I was like, wait, what?
Right.
Like, what do you mean?
Right.
Like, okay, I'll come back. Like, get him up, And
Right.
and I was like, oh my God, I'm gonna be in this hospital for like 15 days. Like, I'm gonna kill myself. Like, I can't be here for 15 days.
I
So
I can now understand why she agreed to do this. She's like, I need a break. I need a
Yeah,
break.
we're kind
yeah,
of like we're a portal into sanity.
We're your
you can't leave. It's a prison. You cannot leave the room. You have to
Yeah.
be here 24/7. So like I can't leave, right? And I was
Yeah,
already
got it.
there the
We'll get
first
you
time.
out. Knock on the
Yeah,
yeah, exactly.
I can't leave. So I was there for 8 days. So I was like, you're getting up. Like I was that mom. I was like, get up.
Amazing. Amazing.
with this, let's Jim, I don't know. Are you ready with your
Yeah, totally. I'm totally.
information?
So
Let's do
Dorsa,
this.
so you get a little formal letter through the fax machine at the Italian hospital one day when you're going through, and it's an invitation back to the hospital system where you started in Santa Cruz.
Yeah.
And you're being asked to address a crowd of Medicare and technologists as the keynote speaker of how to bring together visionary technology companies and practical on the ground Medicare specialists. So you're asked to deliver this keynote talk, and you get up and you talk about your experiences, telling people that they have STDs, delivering medications to homeless people in their parks, saving their lives, making it better, recoding Medicare systems, flying helicopters across the Italian system. So you regale everyone of your stories of your immigrant hardworking ethic that's kind of rooted into you, and the crowd is just enamored with you. And at the end of the crowd, this young woman comes beelining across to you and says, Dorsa, I have to speak to you. I have to speak to you. Understand, I'm just about to start my career. I just finished my nursing degree. My experience, I've met an Italian man in a bar, and I'm
Okay,
just about to
Italian.
start this. And what's the one piece of advice you would give to your younger self as she's starting off in her career?
Take risk. I would say take risk and know your worth. Don't just settle with what comes to you. Know your worth. And I don't know. And somebody said this once, that nurses can pretty much do anything. Somebody who has a nursing brain, like you see nurses in technology, you see nurses in bedside, you see nurses out, you can see nurses anywhere, because I think if the reason you become a nurse is you have passion. So I think you can, if you apply that passion to anything, it goes a long way. And be a good person. You don't have to be an asshole to be successful. I've learned
Love
that.
it. Love it.
Awesome. Molto
Thank
grazie,
you.
molto grazie. Ci vediamo.
Ci vediamo dopo. Grazie.
Thank you.
And
Ciao.
we'll see everyone next week. Hit subscribe, pass it on, and see you soon.